We all know the headline. Cigarette smoking is the #1 cause of preventable death in the United States. But what does that actually mean? What is really happening inside your body when smoke is inhaled? Well, today we're going to pull back the curtain and explore the true anatomy of this addiction system by system. We'll look at the damage and, more importantly, the incredible path to recovery. So let's just start with the scale of this, because it's staggering. 480,000. That's not just some abstract number. That's the number of people in the US who die from smoking every single year. To put that into perspective for you, that's almost 1 out of every 5 deaths in the entire country. Every single year. And the reason for all this devastation? It really comes down to chemistry. A single puff of cigarette smoke isn't just, well, smoke. It is a toxic chemical cocktail of over 7,000 different compounds. Seriously, hundreds of those are known poisons, and at least 69 of them are confirmed carcinogens, chemicals that we know for a fact cause cancer. And here's how that chemical payload gets delivered. It's actually a two-pronged attack. Part of it is a gas, carrying poisons like carbon monoxide and ammonia. The other part is what's called the particulate phase. You and I know it as tar. And that tar is carrying heavy metals like lead and arsenic deep into your lungs. So here's our game plan for today. We're going to start with that toxic introduction from the very first puff. Then we'll uncover the addiction engine in the brain that makes quitting so hard. We'll see how the entire body is put under siege, and we'll look at both the visible and the hidden damage. But we're going to end on a high note with the amazing timeline of recovery and your path to quitting.
All right, let's kick things off at the very beginning with that first chemical assault. Welcome to Section 1, a toxic introduction.
You have to understand, the damage begins instantly. The moment that smoke hits your lungs, it unleashes this massive wave of particles called free radicals. This triggers something scientists call oxidative stress, and it directly attacks your DNA. In fact, studies show that smokers have 20 to 50% higher levels of DNA damage markers in their blood. That's physical evidence of the attack. Okay, so if the damage is that immediate and that severe, why is it so incredibly hard to stop? Well, that question takes us right to the heart of the problem, right into the brain. Let's talk about the addiction engine. The secret weapon of nicotine is its speed. In less than 10 seconds from a single puff, nicotine zips from your lungs into your bloodstream and straight past the blood-brain barrier. Once it's in, it hijacks your brain's reward system, triggering a huge surge of dopamine. And that immediate feel-good hit creates one of the most powerful reinforcement loops known to man. But then your brain does something tricky. To cope with this constant flood of nicotine, it physically changes. It actually builds more nicotine receptors in a process called upregulation. And that's the trap. Because now, you don't just smoke to feel good, you need nicotine just to feel normal. When you try to quit, all those extra receptors are screaming for a fix, and you feel awful. Even simple pleasures don't bring joy anymore.
Now that we get how the brain gets hooked, let's look at what's happening to the rest of the body. In this next section, we're diving into the body under siege, starting with the heart and lungs, which are right on the front lines.
Your cardiovascular system is under attack from the word go. Within just 1 to 2 minutes of a puff, your heart rate and your blood pressure spike. Long-term, that constant stress leads to plaque building up in your arteries. At the same time, the chemicals literally make your blood stickier, which dramatically increases your risk for clots, heart attacks, and strokes.
And this is one of the most sinister parts of the whole process. The carbon monoxide in smoke basically suffocates your body from the inside. See, it latches onto your red blood cells with a grip that's over 200 times stronger than oxygen's. It just elbows oxygen right out of the way, starving your vital organs of the fuel they need to survive.
Meanwhile, in your lungs, those toxic gases paralyze the tiny cleaning hairs called cilia. They can't sweep out debris anymore. This leads to conditions like COPD, which includes chronic bronchitis and emphysema. With emphysema, the little air sacs in your lungs actually burst, and that damage is permanent. A person who smokes a pack a day can destroy up to 200 of these air sacs every single day.
But the damage doesn't stop with the heart and lungs. Oh no! The assault is body-wide. So let's look at some of the other visible and hidden damage.
Smoking absolutely devastates reproductive health. For women, it can speed up the loss of eggs, bringing on menopause 1 to 4 years earlier. For men, it causes DNA damage in sperm. And if a woman smokes while pregnant, nicotine crosses right over the placenta, directly harming the baby's developing brain and lungs.
And yeah, the damage shows up on the outside too. Smoker's face isn't just a saying, it's a real clinical condition. Smoke activates this nasty enzyme called MMP1, which literally eats the collagen that keeps your skin firm. The result? Deep, premature wrinkles and that telltale grayish complexion. It even gets to your skeleton. Nicotine completely messes up the balance of bone health. It blocks the cells that build new bone, the osteoblasts, while encouraging the cells that break down bone, the osteoclasts. This imbalance leads to lower bone density and a 30 to 40% higher risk of hip fractures for older smokers.
Okay, I know that was a lot of pretty grim news, but this is the part of our story where things turn around. It's time for some good news, because your body has a remarkable ability to heal. Welcome to the timeline of recovery.
Just look at this. Your body's ability to bounce back is incredible, and it starts the moment you quit. Within 20 minutes, your heart rate starts to drop. In just 12 hours, those toxic carbon monoxide levels are back to normal. After 1 year, your added risk of heart disease is sliced in half. And after 15 years, it's almost as if you never smoked at all. It is truly never too late. And here's a fantastic benefit you can experience almost right away. Your sense of taste comes back. That tar coats your taste buds and dulls flavors. But within just 2 weeks of quitting, the tip of your tongue starts waking up again, and you can really start enjoying food again.
All of this incredible potential for healing leads us right to our final and most important section, your path to quitting.
I want to leave you with this powerful analogy. Just imagine the delicate lining of your lungs or your stomach is like the skin on your arm. Smoking is like pouring a powerful drain cleaner on that skin, over and over and over again. Your body desperately tries to heal between each assault, but if it's constant, the damage eventually becomes permanent.
So after everything we've just seen, the chemical warfare, the brain hijacking, the systemic damage, and the amazing potential for healing, it all really boils down to one crucial question, doesn't it? What is the single most important step you can take for your health, no matter your age or how long you smoked?
And the answer is right there. It's to quit. Your recovery, your body's healing journey, can start right now, today. There is free, confidential support out there ready to help you. Just remember, every single breath you take without a cigarette is a powerful step toward reclaiming your health and getting your future back.